Hello, my name is Dr. Phil Boyle, founder and director of NeoFertility, and I want to present to you our data from our practice in 2015 and how do we compare with in vitro fertilization. So, what does our data look like? First, we need to take a closer look at the IVF data. These are official figures reported from the HFEA in the United Kingdom, where they could look at total number of cycles started and how many live births were achieved for everybody who did in vitro fertilization in the United Kingdom for that year. These data show on average 1 in 4 couples achieve a live birth per treatment cycle started. Often, IVF clinics will quote clinical pregnancies per embryo transfer, and this is a 1 in 3 pregnancy rate per embryo transfer. So it gives the impression that the success rate is higher than what it actually is. The data I obtained were from the Human Fertilization and Embryology Authority, the most recent data available online at the time of this presentation in March 2020. The figures from the HFEA show IVF birth rates per embryo transfer are improving year on year, and the most recent data are 21.9% live birth rate per embryo transfer. The data is a little higher if we look at IVF birth rates per treatment cycle, with the highest numbers coming in 2015 at 27.5%. In 2016 and 17, these figures dropped off just a little. If we look at the data spread out by female age, under 35, you will have a 32% live birth rate with 1 round of IVF per treatment cycle, and this drops to less than 3% when you're over age 44. If we compare these data, 1 single round of IVF per treatment cycle compared with the expected live birth rate over a year of attempted natural conception, the numbers don't compare very favorably. The green bars looking at the expected live birth rate per year are based on assumptions from clinical data, and the hard data is difficult to find, so this is an estimated curve. With NeoFertility in 2015, we had 412 couples who attended for 2 or more consultations. There were 132 live births, giving a crude live birth rate of 32%. 86 couples, or 21%, had previously tried in vitro fertilization prior to attending our practice. From our data, we had 1 multiple pregnancy, giving a multiple pregnancy rate of 0.75%. The average female age from our practice that year was 37 years. Birth details were very interesting. We obtained data from 131 out of 132 pregnancies. Our 1 multiple pregnancy, remarkably, was a triplet pregnancy. We had no twins. Thankfully, our triplets did very well and were delivered at 31 weeks and 5 days by elective cesarean section, and all the babies were fine. We see this about 1 out of every 600 pregnancies. Our incidence of low birth weight was very good at just 5%, under 2,500 grams, or 1.6% less than 1,500 grams, and our preterm delivery rate was 4.2%. This compares very favorably and is better than what would be expected in the general population, but considering we're dealing with a group who have infertility, these are striking figures. We could not find data to compare with in vitro fertilization, but our expectation is these numbers would be significantly better. NeoFertility treatment is a process over time. We have people that we refer to as early quitters, and obviously these will have a lower pregnancy rate. Our accrued pregnancy rate calculations include these early quitters and actually underestimates the true effectiveness of NeoFertility treatment. If this is a treatment process over time, those who attend for 2 consultations and then discontinue will have a lower pregnancy rate compared to those who persist with treatment for up to 5 medical consultations, which can take anywhere up to 2 years maximum. When we include our data for early quitters, we compare very favorably with in vitro fertilization. The figure of 27.5% was the total per treatment cycle live birth rate for a single round of IVF in 2015, and our accrued data total numbers come in at 32%. And you can see for every age category, NeoFertility compares very favorably with in vitro fertilization. Still, we can contrast this with the expected live birth rate for the same ages, and we can be somewhat disappointed and hope that we could do much better. It is now proposed that a single round of IVF often is not enough. The New England Journal of Medicine in 2019 looked at IVF as a treatment process over time, where they analyzed data for those who would have 3 rounds of IVF. A significant number of patients dropped out and did not complete the 3 rounds of IVF, so they applied an optimistic interpretation similar to our live birth analysis, which we'll look at later. Bear in mind, the minimum cost just for the IVF procedure would be expected to be €15,000 for 3 cycles of IVF. You can see from the blue bars, the numbers are significantly better with repeat attempts at IVF, and appear to eclipse the results we have for NeoFertility, which is in the red bar. But we can also apply a statistical correction for our early quitters using life table analysis, where we look at the outcomes at 12 months, 18 months, and 24 months of NeoFertility treatment. For those who persist with NeoFertility treatment for 1 year, these are the results we can see. If you persist for 18 months, the numbers are better, again, because this is a treatment process over time, and if you persist with treatment for longer, the pregnancy rate will be higher. And the maximum, right out to 2 years, we can see it compares very favorably with up to 3 cycles of IVF and is coming very close to the expected live birth rate according to female age. But cost considerations are significant. If your budget is €5,000 or less, here is the comparison. 1 round of IVF versus up to 2 years of corrected cycles with NeoFertility treatment. Many people would say, 2 years, we can never do that. We don't have the time. No way. Well, even if you persist for 1 year, the data with a restorative approach using NeoFertility is superior to a single round of in vitro fertilization. What about the IVF multiple birth rate of 10%? Thankfully, this is a significant improvement on previous years of IVF data. A multiple birth, twins, triplets, or more, is the single biggest risk to the health of patients and their babies undergoing IVF. The baby is 6 times more likely to be born prematurely, leading to long-term health problems such as difficulty breathing, cerebral palsy, physical and learning difficulties. If you have 100 live births and your twin pregnancy rate is 10%, that's 110 babies, assuming they're all twins. There are 90 singleton pregnancies, and 20 out of the 110 babies is a twin baby. This is 18.2% of all IVF babies are twins, which is almost 1 in 5, who are 6 times more likely to be born prematurely and subject to all the risks I mentioned. The advantages of NeoFertility: we have a less than 1% multiple pregnancy rate. It's safe for babies who are mostly full term. With a good birth weight, our average birth weight was 7 pounds 7 ounces, and the majority of babies were healthy. In addition, repeat pregnancy is much more likely. Health improves during treatment. Women report fatigue, period pain, PMS, low mood, and autoimmune conditions all improve significantly and often dramatically during treatment. Our treatment is safe because we only produce one follicle at a time and restore a normal balance to the cycle. This means side effects are minimal and our treatment process is completely non-invasive. Couples often report an additional advantage of improved communication. In summary, if you want a treatment that is effective for nearly every type of infertility, including repeated miscarriages and low AMH, a treatment that is affordable with minimum side effects will lead to health improvement with a very low multiple pregnancy rate and a higher chance of a healthy baby and a high chance of repeat pregnancy, provided you're willing to commit to a process over time, then NeoFertility is a strong option for you to consider. Thank you for your time. Bye for now.